Welcome to the Transplant Institute at Methodist Dallas Kidney Transplant Education video series. This video will provide an overview of the transplant evaluation process. In order to begin the transplant evaluation process, you must complete a transplant application to be referred to the Transplant Institute at Methodist Dallas. Your dialysis center will be able to provide this application and submit it at your request. Once you receive your referral, one of our financial coordinators will begin working on your financial approval, which begins with insurance verification. This can include verifying that our providers are in-network, pre-authorization requirements, and determining if the transplant evaluation is covered under your plan. The verification process can take a matter of days or weeks, depending on the insurance plan. Once you have been financially approved, a transplant coordinator will call and perform a pre-screening assessment. This will include reviewing your medical history, the status of your kidney disease, and medications. These health questions will help the transplant coordinator create a transplant evaluation plan that is tailored specifically for your situation. The transplant evaluation is a series of tests to establish your overall health and confirm that transplantation is your best option. The evaluation will consist of lab tests like blood work, and procedures such as chest x-ray, EKG, ECG, and CT scan of your abdomen, just to name a few. Consultations will be done with a dietitian, transplant social worker, transplant nephrologist, transplant surgeon, and an infectious disease doctor. During the evaluation process, you will attend an education session with your transplant coordinator. All of these tests and evaluations will be conducted at Methodist Dallas Medical Center over the course of days or weeks. When scheduling these appointments, your transplant coordinator and scheduler will be mindful of your dialysis schedule, as well as any other scheduling factors you may have. Our goal is to have each transplant applicant complete the evaluation process in 90 days or less. Many factors can influence this, including your insurance company, dialysis needs, or specialist consultations. If you are traveling from out of town, we will work with you to complete your evaluation testing in as few visits as possible. Once you have completed all the necessary testing, your case will be presented to the Transplant Selection Committee. This committee meets weekly and is made up of many members from your transplant evaluation process, so that a varied set of perspectives are considered when deciding who is a good transplant candidate. You will receive a decision within 2 weeks via a mailed letter to you, your referring doctor, and dialysis center. If approved, the financial coordinator will begin working with your insurance company to get you on the transplant wait list. If further testing is needed, those tests will be scheduled, and once completed, your case will be resubmitted to the selection committee. If denied, a letter stating the reason will be sent to you, your referring doctor, and dialysis center. Getting listed for an organ transplant is a big milestone in your health journey. The next step of waiting for a kidney requires patience. The average wait time is 3 to 4 years. During this time, it is very important to stay healthy. We will contact you once a year to schedule your annual health screening, which is required to stay active on the waiting list. Take this time to make a detailed plan with your support system for when the call comes that a kidney offer has been made. Thank you for watching. To continue learning more about kidney transplant at Methodist Dallas Medical Center, please view all of our education videos.